We know that we have astronomical levels of state debt, and this leaves, according to Solidarity, I mean, a tax surcharge of 20%, a VAT increase from 15 to 20%, extra payroll tax, or extra corporate income tax, or combination of these things is the only way to fund national health insurance. And I mean, we already taxed higher than other countries in our GDP bracket. We pay double taxes for many private, essential privatized services such as healthcare, security, those sort of things. We pay double, and schooling, we pay double taxes for that. And it's estimated that 20% of our taxpayers pay more than 3/4 of all income tax. So this is all the fact that all these arguments just renders all the other arguments for national health insurance academic, because it means that this bill is unaffordable. And then we also know it's unfeasible. I mean, we know that state-owned enterprises have been absolutely hemorrhaging money over the last decades, and we know that half of the COVID relief fund was investigated, and it was found that half of the COVID relief fund was actually stolen. So this is a very, very serious problem, and we don't have to listen to what I'm saying. We also have to listen to what the health professionals are saying. And the South African Medical Association warned that there would be mass immigration of health professionals if this bill were to be implemented.
Well, certainly, and obviously there are still many, many unknowns, but looking at the government, and one of the concerns you've raised is the government using the NHI as a political tool, a way of garnering votes from poor South Africans and those who have legitimate grievances regarding the quality of healthcare in this country.
That's a very good point, because we as AfriForum, of course, we want all South Africans to have access to not just healthcare, but we want South Africans to have access to good quality healthcare. That's a very important thing. But our solution wholly differs from the government's idea of nationalizing and monopolizing the health sector. We say that we need to further expand the private sector to make the private sector more competitive, and to allow the workings of the free market to drive the prices down for purchases. And also, a lot of the current problems with healthcare can be fixed by simply sorting out the governance and the administration issues in the public health sector. I mean, in the last audit, the Western Cape the Provincial Health Department was the only health department to receive a clean audit. So we know that there are serious administrative issues at the public hospitals in the public sector, and this needs to be sorted out before we can even start thinking about implementing something like this.
Yes. Now, also looking at the private healthcare sector, and just to understand, Reiner, what impact this is likely to have on the private healthcare sector, because we know at this point in time, obviously, we are enjoying quality healthcare coming through. It has been proven over and over again. Are we looking at risks or high risks as far as the private health sector goes?
We are looking at extremely high risks, and I cannot stress this enough. We argue that the implementation of national health insurance will destroy the entire healthcare sector. So it's a very, very serious matter. What we are seeing is that one of the big issues is that 38% of the medical association's members warned that they would immigrate if national health insurance were implemented. A further 17% said that they were still unsure whether they would immigrate if NHI were to be implemented. And another 6% were already planning to immigrate due to other reasons. So we know this will cause serious problems. It will absolutely be catastrophic for the future of this country. So we have to really stand together and unite and unite in opposition against this bill.
Yes. Now, also, I think one of the biggest issue is the government having access to people's medical information. And I think this is obviously a big concern, considering when one looks at what has happened during this COVID era, how governments have actually changed in terms of, the bureaucracy, in terms of what we've seen, what has happened with things like disaster management, and also as far as just having people's information is concerned. And this is absolutely critical. And looking at, a national database, looking at, should the government be actually getting involved in these type of things?
I mean, let's just be honest. the government, everything it touches, it's like a reverse Midas touch. We've called it in the past. So everything it touches, we know there've been some serious problems. We know the government has also been unwilling to relinquish some of the powers it obtained under the Disaster Management Act during COVID-19. We also have a court case in that regard with regard to the government being unwilling to relinquish the powers afforded to it during the COVID-19 pandemic. In terms of the government gaining access to people's records, that isn't the main concern. Our main concern is simply it's unaffordable. So that renders all the other arguments academic. And then it's also unfeasible, as we know that state-owned enterprises hemorrhage money. They are not efficient. They are not efficient enterprises. And then also we know that medical doctors will immigrate inevitably if this is implemented. So those are the main arguments we use. And I mean, the fact that it's unaffordable should already render all other arguments academic.
Yes, just how far, Reiner, is AfriForum prepared to go with this?
Well, we've been involved in the legislative process. So we submitted our commentary on the bill. We then also did a parliamentary oral presentation in the parliament. We also published a number of reports on national health insurance. So we are really, really well clued up. We've done our research. We are intimately and closely involved in this process, and we've participated at every single opportunity afforded to us in the legislative process. Unfortunately, if this bill continues in its current form, we will have to, when it is, in fact, if it is implemented, and when and if, we will have to take legal action against it, and we'll have to have it struck down.
Well, we're going to definitely watch your space, Reiner, but as always, we appreciate you taking time out. Thank you for your time and talking to us this morning. We wish you all the best.
Thank you so much. Thank you.
Reiner Duvenage joining us this morning, looking at AfriForum, criticizing the NHI and also at the same time urging the President and the Minister of Health to reconsider the implementation of the National Health Insurance Bill. And this is a letter that they sent through to the government, telling the government that the NHI is unaffordable because taxpayers are already overburdened, and we are looking at being taxed higher than other countries, and also at the same time looking at a number of concerns, particularly the failure of state-owned entities, and we know what the SOEs have been doing, and basically the government has just been pumping money into these state-owned enterprises that have basically failed, that have been corrupt, that have been riddled with corruption all over the show. And again, at the same time, looking at what this actually means for the future of healthcare in this country, and particularly looking at medical professionals, will they be leaving the country in droves? And we know at this point in time there is already a shortage of quality healthcare professionals within the public sector. So this fight obviously is going to go on, and it is the government obviously treading on dangerous ground when they are talking. And again, we need to differentiate between what the government is capable of doing, what it is not capable of doing. And at this point in time, with the track record, with the history of this government, they seem to have had very little success. The COVID funds is just one clear example where we know that how they were misappropriated, and also at the same time, there have been a number of investigations. We've seen the Zondo Commission. We've seen in many instances where these funds have gone through to the government, and we know what has happened. So once again, is the NHI a good idea as far as the South African government is concerned, particularly in the light of its own track record? The time is just gone 8:32. We're going to go for a break. We'll be back.